I'm Jeannette Southpaw. I am the chair of the Department of Family Medicine at the University of Pittsburgh and UPMC.
I met Dr. Southpaw when she first arrived on campus as the chair of the family division of the School of Medicine.
I met Dr. Southpaw in 2000. I was moderating a conference in which she was a speaker.
I first met Jeannette Southpaw when I first arrived at UPMC.
And I thought, what a awesome individual.
Jeannette was so impressive in those meetings in terms of her commitment and her passion for people who are really underserved.
My first impression of Dr. Southpaw was that she is an individual of character.
One of the first things that I find I'm often telling people, and I've said it at least twice this morning already, is that I look at the world as a glass that's half full.
Back in 2000, she was leading the way in terms of describing her efforts around promoting cultural awareness within our nation's medical schools and training programs for physician trainees.
I've been very interested in cultural competence because I believe that if we are going to be effective educators, healthcare providers, and citizens, we need to understand the different experiences people have. And that's really what culture is all about. Culture is recognizing that it's not about taking care of people with a disease. It's easy to study a disease, but how the person experiences that disease is what an illness is. And how the person experiences that disease is shaped by their background. Those are the things that we have to be attentive to if we're going to be good at taking care of diseases as they manifest as illnesses.
Her willingness to stand up for what she believes in is one of the things that really touches me the most, and that I think is so admirable.
When you spend your time working in a number of different areas and you don't feel as if you're necessarily working for people who get a lot of voice in society. I mean, when you think about people who are struggling, it's not only those who are struggling socioeconomically, it's those who are struggling because of low literacy, those who are struggling because they're in communities where they're exposed to environmental toxins that they may or may not know about, those who are struggling because of disabilities. When you think about that population, I feel we have a lot to do, and it's a population I'm committed to, all of those who are underserved, medically underserved. So to receive an award like that, it makes me reassured that maybe someone's noticed that I really do care about our communities, and I want to continue to work in that area. And it's humbling, and it makes me feel good.
I think her impact goes beyond Pittsburgh. She is truly a national resource.